So our next question is, the Van Prognostic Index is not based on which of the following factors, right? Which of the following factors? So let's see few things regarding this index. Coined, or it is basically stratifies the patient with a ductal carcinoma in situ. So it's basically used for the DCIS patient, right? And in case of DCIS patient, the aim of this index is to predict the risk of recurrence after the surgery, to predict the risk of recurrence after the surgery, so that we can modify our part of the post surgery treatment. Like, what is the post surgery treatment we can give to the patient, that will basically determined by this prognostic index, just to simply stratification of the risk of recurrence after the surgery, right? So this is the Van Nuys prognostic index for you. So it basically, as I have mentioned, it basically helps us to guide the treatment decision, guide the treatment decision typically after the mastectomy or after the BCS. So there is a four parameter is there, which is basically taken under the consideration. So your number one is the age of the patient, number two is the tumor size, right? And obviously then comes your surgical margin status. Surgical margin status being one of the important uh, one, but also apart from that, there is a histological grade with a presence or absence of the necrosis has been there. Okay, so the four parameter that has been used in here, number one is the age, number two is the margin status, number two is the tumor size, and number four is the histological grade. And that will also whether there is a presence or whether there is absence of the necrosis has been there or not, right? There or not. So this four factor is basically given 1 to 3 points for each, and the total score is supposed to be between 4 to 12, right? So we can again stratify. Our aim of this prognostic index to stratify according to the risk of recurrence, right? So here the risk groups are basically divided into three. There is a low risk, there is intermediate risk, and there is a high risk group, right? So your total score is around 4 to 6 in case of low risk group, right? But here in case of intermediate risk group, it is basically your 7 to 9. 7 to 9 score is associated with intermediate risk, and your 10 to 12 is basically your high risk patients. So in case of low risk, obviously your BCS alone would be enough. Why it is alone? Because the risk of recurrence is only around 9%. So we can obviously leave the patient after the BCS and simply just putting the patient on regular surveillance in that case. But your intermediate, they basically associated with the 20% of recurrence rate. So that's why we need to start the patient on the radiotherapy, on the radiation therapy in a post BCS. But in case of high risk groups, which are basically associated with a recurrence rate of around 50%, in that case, mastectomy is typically preferred.